All right, some applause. I have never gotten applause before one of my talks. I usually get it after, but thanks. So this is officially the largest group of people I've ever given this presentation in front of. We only have like 45 minutes, so we're going to try to go as quickly as we can. So we're handing out some information that has a worksheet on it. If you don't get one, don't get too nervous. I'm pretty good at explaining this stuff, but you can kind of follow along in your worksheet if you get one. All right, so did you know that a spinal surgery costs a minimum of $100,000 and can reach as high as $169,000 to do a lumbar fusion? Did you guys know that? Like how much that costs? Expensive, right? Okay. As a result, we're spending around $96 billion on the treatment of low back pain in the United States, with an indirect cost of treating low back pain reaching over $200 billion. Right? It's a lot of money. Okay. So I'm going to try to teach you how to get your spine to last 110 years. We said body in the presentation, but what's the most important part of your body? Your spine. If your spine is not working, your body's not working. So that's what we're going to focus on. All right, so cost of common treatment for low back pain, right? Spinal surgery, we talked about that. Injections, anybody ever get injections for their spine? Hey, that's what it's costing to do that. Hey, it doesn't mean it costs you to do that, right? Some of it is you, some of it is your insurance company, but this is the cost to the United States. MRIs, anybody have those? Right? $2,600, that's an average. My brother got an MRI, cost $17,000. Okay? So that's an average. They can reach higher. Okay? If you want to talk to me about that later, we can talk about that. But course of physical therapy, about $1,200. Reasonable, right? Okay, let's take a look to give us some perspective on what it costs to treat other problems. All right, COPD and asthma, pretty big thing, right? $80 billion, less than treating spine. Mental disorders, $57 billion, less than treating spine. High blood pressure. How many people in this room have high blood pressure? And don't do the thing where I don't have high blood pressure because I take a bunch of medication. That means you have high blood pressure, okay? $42.9 billion, much less than treating spinal pain. Hey, joint disorders, osteoarthritis, that kind of stuff, right? Hey, $80 billion. Childbirth, I put this in here just because, for some perspective, right? So we pay more than twice what we pay to allow for childbirth in the United States than we spend on treating low back pain. That give you guys some perspective about what we're talking about? Okay, so what if I told you I have the solution to this $100 billion problem, and it lies in this piece of plastic pipe I got from a hardware store. It costs about $1.34. Laughing, that's what I want. You would laugh, right? You would laugh at me. It's okay, you can laugh at me. Okay, so here's the truth. Nearly 100% of these surgeries and procedures and costly things are preventable if you speak the language. Okay? So this is me. I'm Travis Robbins. I own Robbins Rehabilitation. Me and my twin brother, we've been around the valley for 14 years. Anybody ever heard of Robbins Rehabilitation? Terry's here. All right, buddy. All right. I have a lot of roles, right? So I'm a dad. I'm a coach. I'm a husband. I'm a business owner. I'm a physical therapist. But I'm an educator. That's really what I do. So I educate on lots of different levels. We have tons of students that rotate through our offices. I teach at colleges. But probably the most important teaching that I do is right now. Like the next half hour of my life is like the most exciting part of my week. Because I've got to take everything that I know about the human body, which is a lot, and break it down into information that you guys can actually use. So that's what I'm trying to do today. So this is the most important thing that I do, is educating people about how the body works. All right. There are 3 non-negotiables. Anybody know what that is? Like, we cannot break on this. Non-negotiable, okay, to having a healthy spine. 1, neutral spine. Anybody know what that is? Neutral spine? It's like good posture. Anybody heard of good posture? What is it? Nobody knows. Standing straight. That's probably the closest thing we get to. So we're going to go over that, right? Hip mobility. Anybody know what mobility is? Yeah, flexibility, movement, incorporates a lot of different things, but mobility is it encapsulates more in terms of how much a joint or a group of joints move. That's really important for spine health. And nerve mobility. Anybody know what nerve mobility is? Yeah, most people don't, so we're going to talk about that. If you've come to see me before, Terry knows what nerve mobility is, but maybe everybody else doesn't. Okay, if I could only teach you one thing, right, because I'm already running out of time, and the one thing I would teach you is a neutral spine or a good posture. Heard this before, right? Supposed to have good posture. Your mother told you, your grandmother told you, sit up straight, that kind of stuff. What is good posture? I'm going to teach you what that is in about 3 minutes. Okay? So this piece of pipe, which we're going to go over, if you guys come by my booth, I actually have a limited amount of this, so I'll give it to you if you come by my booth, if you like the talk. If you didn't, you probably don't want to come by my booth, but we'll see how it goes after. Right? This piece of pipe costs a little bit over $1. Okay? Good posture is if you're in any position, standing, sitting, walking, moving, if I put this pole on your back, it would touch in 3 spots. It would touch in your tailbone, it would touch in your thoracic spine, and it would touch in your head. So your thoracic spine is in between your shoulder blades. Okay? All right? So if I put this pole there, that's good posture. Right? What happens to a lot of people, right? So a lot of people they kind of lose it from here, right? You ever see people at the grocery store that are kind of walking around like that? Okay? So their spine's out of neutral. Okay? You're never going to spend 100% of your time in that position, but you want to spend as much of your time in that position as possible if you want to have a spine that lasts 110 years. Okay? So we call this the freeze test. So I talk to my patients and I say, I'm going to follow you around all day. You're not going to see me. I'm going to jump out of your bushes or like behind some piece of equipment at work, and I'm going to say freeze. Hey, I'm going to walk over to you and I'll put this pole on your back. Okay? If I can put that pole on your back and within some reason it touches those 3 spots, your spine is in good position. Okay? So this is information that I just gave you that everybody can understand and relate to. Okay? If you have someone at home that can help you put this pole on your spine, that can be helpful by just putting it on your spine yourself and just kind of moving with that spine, with that pole on your spine. That's how you have good posture. Okay? So learning that, or learning a new motor pattern, which is kind of a fancy word for learning a new way to move, how many repetitions do you think that takes? Close, 3,000 to 5,000. Okay? So the 2 main things that we teach with a neutral spine is you've got to be able to bend and squat. Okay? So from here, a bend is just a hip hinge. Okay? So from here, I can do this, and that pole stays on my back. Okay? Where's the motion coming from when I do this? Anybody know what joint? Yes. All right, so it comes from your hip, right? Where most people get this motion from, like if I was going to go down and bend to pick something up, where would the motion come from? You guys hear that? My back actually cracked. So when I bend forward, I'm bending from my spine here, and this thing comes off my tailbone. Right? My spine comes out of neutral. Right? The more time your spine spends in neutral, the better your spine is going to be, the longer it's going to last. Right? So here, this is all hip motion. Hips are huge joints, ball and socket joints designed for large motion. You've got to use those as much as possible. If I do this, I'm not using my hips at all, right? Does that make sense? Okay? So now what happens when I have to pick something off the ground? I have to be able to squat, right? Or bend my knees or add knee incorporation. So sit to stand, like if you're in a chair there, just moving from sitting to standing and doing the same thing. So as I do this, okay, I'm getting a lot of that motion out of my hips, right? My spine is not moving. It might seem like my spine is moving, but my spine is not moving. And you want to have motion come from your hips, knees, ankles, large joints in the body. Okay? So if I give almost everybody in my spine programs that come in those 2 exercises. Those are the 2 most important things that I need to teach you. Okay? If you can figure that out, you're not going to have back pain. It doesn't seem possible, but it is. But it takes a lot of work, right? It takes 3,000 to 5,000 repetitions. So what we typically do in our office is we say, okay, you're not going to get through this today, but I'll give you a piece of pipe, go home, brush your teeth in the morning, do 10, 20 of those, each of those exercises. At night, brush your teeth at night, do 10, 20 of those. Right? And over a certain period of time, you'll get that. And I actually had one of my accountants, which will make sense after I tell this story. He came in one day and he said, hey, I did it. I said, you did what? I got the 3,000 repetitions. And he showed me his book, and he had been ticking off he's an accountant, right? So that's, right? But that guy, he doesn't have any back pain anymore. Okay? So learning that is key. Okay. Healthy spine, what does it mean to you and your family? A healthy spine is a happy spine. Right? Back pain stops you in your tracks. Anybody in this room had back pain? Okay, so about 90% of you should probably be raising your hands, because that's what happens. About 90% of people go through life, they have some bout of back pain, right? So you can't work, you can't sleep, and you can't be normal. You can't do normal things. When I was in college, I herniated 2 of the discs in my lumbar spine, and I had terrible, terrible back pain. Right? So I know what that's like. If you've had back pain, trying to tell someone else that never had back pain before, it's not even a reasonable conversation, because you have no idea how much that just kind of takes over your life. Like a lot of my patients, I have a high tolerance for pain. I have no tolerance for pain. So I threw my back out about a year ago. I don't know if Katie's here. About a year ago, every once in a while I'll do something stupid and my back will go out and then I have to have it fixed. I'm miserable. My kids don't like me. My wife don't like me. My employees don't like me. So you guys know what that feels like. You have to have a spine that's working properly in order to be a happy human being. Okay? And the crazy thing is, it's not that hard. I taught you the most important thing that you need to know in like 3 minutes. Okay? All right. So we're going to talk a little bit more specifically about back pain. But if you come talk to us after the seminar, then I build out a course for you. I have 2 courses. So I have a course that gets you to get your spine to last 110 years. So we didn't do a sign-in. If you guys are interested in doing these video courses, it's basically a more in-depth version of this presentation. I send you videos, and it kind of shows you the things that we need to do here in a little bit more detail, because I don't have the time to show it all in detail. Okay, so I have there's 2 courses. One is more if you're having back pain right now. That's more for you. If you're not having back pain, great, and you want to get your spine to last 110 years, different set of exercises, different course. So if you're interested in that, let us know. Okay, so you can come at the end of the seminar in the room, or you can come to our booth after, and we can sign you up for that. Here's my information. Okay, if you guys want to write that down. That's my cell phone number. My patients call me all the time. I don't know how many people give out their cell phone number. People say I'm crazy for doing it, but if you guys have any questions about anything, this is my email. It's my personal email. I answer everything that goes in that email as best I can, and that's my cell phone number. Okay? All right, so my cell phone number is probably not in there. Hold on, I think I can go back. All right, I'll just leave that up there because we're done with the slides. All right, so if you guys have worksheets, we're going to work off of that. Okay? So what is Robert's Rehabilitation and why should you care? So privately owned physical therapy clinic, not many of those left. We've got 5 locations in the Valley. It's me and my twin brother that started it. We have 14 clinicians now, and we're doing pretty well. We're still open. So let me tell you a little bit about my history with back pain. So I told you kind of what went on with my personal history with back pain, so I can appreciate anybody that's had back pain, which is important. But when I got out of school, I thought I knew everything. Everybody get out of school and thought they knew everything, and then like 6 months in, you realize you didn't know anything. That's kind of how that goes, right? So started treating patients. I took my first job in Boston. I'm basically unemployable, so I had like 9 jobs, and then I opened up my own practice when I was 23. But when I going through that process, I kind of thought I knew what I was doing, but I would treat spine pain, and I didn't have the best results. So this is kind of what happened. About 50% of my patients, they got better, right? They improved, but they didn't get complete resolution. I'm a pretty competitive guy, right? So that's kind of bothersome to me. About 25% of my patients, they loved me. They wanted to adopt me as their second son. They thought I walked on water, and whatever I did worked. And about 25% of the patients that I saw, no matter what I did, I threw the kitchen sink at them. Nothing made it better, usually made them worse. Right? So these aren't good, right? This is okay, but this 25% is not good. Right? So what happened is, I'll tell you the quick story. This guy came into my office, and he dropped off his resume. Anybody give out resumes recently or like accept resumes? I don't know what the rule is now. Like we mostly have LinkedIn. We don't do resumes anymore. But it used to be like front of a page. That's all you had to do. So he was front and back, 4 pages, single space, 10 font. It's all the things that this guy had done. Okay? So he was professor in all these schools. He was manual therapist, all this different stuff. And we said, well, you know, our success rate's not great. I think we hire him, we can at least improve that. So we hired him, right? And he was a fellow in the Manual Therapy Institute, which means he's a fellowship FAAOMPT. So if you ever see my name, that's what's going to have after it. So therapists love alphabet soup, right? If more letters we can put after a name, the better. So basically, it was training that I ended up doing through the Manual Therapy Institute. So it's about 2.5 years of school where I would fly to Chicago and learn stuff that I didn't learn in physical therapy school. Physical therapy school can only teach you so much. You got to get advanced training after that. So, and then after 2.5 years of school, you do another 2 years of residency with someone that's faculty in the program. So after that, what happened is we kind of learned from Dave for a little while, and then I went and took the programming, and then now it's about 90-10. So about 10%, and I still don't like this number, about 10% of patients I can't get complete resolution of, but about 90% are pretty happy. Okay? And those are pretty good success rates. So if 90% of people that come in and have back pain have a complete resolution conservatively, right, then that's pretty good. So that's why I kind of teach this stuff now, because every industry is different. Physical therapy is different. Some people, I've been to physical therapy, didn't work, right? Anybody been to physical therapy, didn't work? Yeah, right? Yep. So everything is different. Right? All different kinds of physical therapy. What we do is fairly successful. So let's talk about more specific stuff about low back pain. So if you have your sheet here, the sciatic nerve is the what nerve in the body? Anybody know? Longest, you got it, or largest, right? It's the biggest one. Okay, and it's actually 2 nerves. So in the next line there, it says it travels from the low back, right? So lumbar spine, down the back of the leg, into the foot. So it's actually the thickness of your thumb. So when it gets to its biggest part back here, that sciatic nerve is huge. And then as it gets to a couple inches above your knee, it splits off into peroneal and tibial nerve. Okay? It's not important you remember all this stuff, but just gives you some anatomy there. So sciatica sufferers may experience what numbness or what in the leg, do you think? Tingling? Pain, right? Pain, numbness, or tingling. Right? Someone that has some kind of nerve irritation, some kind of nerve compression will complain of those symptoms. All right. Anybody ever have pain, numbness, tingling going down their leg? Okay. So let's talk about sciatica. It's just kind of a garbage pail term for any pain that goes down the leg. Finding the cause of that is what's really important. And that's where people have kind of failed conservative care, right? So if you don't find what's causing that, there's lots of things that can cause that. If you don't find that specific cause and attack that cause, you're not going to have success. You're going to be over here in the 25% of people that I used to not fix. All right, so the most important question that I ask a patient when they come in is the pain, numbness, or tingling reproducible? Meaning, is there something that you can do that makes the pain worse? That's actually a good sign, which is confusing, right? But if you can say, yeah, when I get up in the morning or when I bend over to tie my shoes, the pain gets worse. And then if you do something else, usually the reverse of that, if it gets better, like you're going to be in this 90%. Right? If someone comes in and says, I have terrible pain constantly, 9 out of 10, morning till night. Like you're not staying in my office very long. That's not a candidate for physical therapy. If there's not a mechanical cause of that problem, then you're not for me. You're for ortho consult, right? So if it's reproducible, then it's likely reducible. So that's what that fill-in is there. So if you can get some, and we're going to try to figure it out today, depending on the space that we have, but we're going to kind of go through a really basic motion diagram, what we call them at work, but basically I want you to go through some motions, and then you're going to write down exactly what happened. Because I want, as best I can, right, so I can't see all of you individually right now, but we're going to try as best we can to get you to find your cause of back pain. All right, so if you're comfortable, it's not bothering you, you've got room, I want everybody that wants to find out what's causing their back pain to stand up. Okay. And we're just going to do 4 motions. Okay? Okay, so the first motion we're going to do is we're just going to bend forward. Okay? So legs straight, and you're just going to bend forward and touch your toes. If that makes your pain worse, I want you to remember that because we're going to have to write it down. Right? So just bend forward as far as you can go. Good. And then come back up. So if that made your back pain worse, then just keep it in your head. We're going to do the opposite thing. Hands on your hips. You're going to extend back. Does that make your back pain worse? Okay? If that does, remember that. Next thing we're going to do is we're going to slide to the right. Okay? This way. Good. Does that make your back pain worse? And then come back up, and then we're going to go the other way. So fine, if that makes your back pain worse, then just kind of remember that. It's on the sheet there, bending forward, backward, bending to the right, bending to the left. Okay? And especially if one of those motions is the most painful. Does anybody have like side-to-side motion is the most painful? Yeah? You want me to fix it? Come on up. All right. What's your name, young lady? Randa. Randa? Oh, that's a cool name. I never heard that before. All right, do you want to tell us a little bit about your back pain? How long you had it?
Many, many
Many, many years.
years.
How many people can say that, right? That's usually what happens when they come in. All right. What activities make your back pain worse? Like motions, positions?
Oh, gosh, when you said lean to the side and even like reaching, stretching.
Okay. How about sitting for a long period of time, standing for a long period of time?
Standing, it's achy.
Ache, okay. And then so the sharp pain, what was the most painful this motion? So going to the side?
So I forget which side though.
Well, we can redo it.
That side right there.
So you go to the left, and where's the pain?
Right here.
All through here. Okay, bending to the left, pain through the right. Okay, so let me check something here. I'll do the same thing on the other side. Okay, no pain there?
Oh yeah, on this side.
Pain on that side. Which of those motions were worse, right or left?
This one.
Okay, all right, so come back up, and I'm going to apply a little pressure, so do that again to the left. Hey, worse, better, same?
Feels better.
Why is that?
That compression, I guess.
Yeah, you're close. So I did this. I put some pressure there, and the pain got better when she did that motion. Why'd that happen? Don't overthink it. Right. So I stabilize the joints that are not moving properly. When she bends to the side, there's some kind of mechanical joint problem that's going on there that when she does it on her own, doesn't work. The muscles aren't activated properly. When I do the job that the muscles are supposed to do, they say, oh yeah, it feels better. I didn't take it completely away, but improved, right? Yep. I got her already. She's impressive. Right? Okay. So hold on, we got to figure out. Okay.
Really
I want to. I can't let you go away. So does everybody get that concept though? Because that's really important. So everybody's heard of like core stability, or I got to get stronger here, right? That kind of stuff. So that's a complicated subject that hopefully we'll have time to go over. But you guys kind of get that concept, right? All right, so let's try to find out what is causing that problem. Can you lay down on your back with your head here and then feet down this way?
Sure. All right.
When you have your pain, is it like right in the middle? Is it more on the right, more on the left?
It's more on my right.
More on the right side. Okay, so from here, I'm going to have you bend both your knees. Good. Push down with your feet. Lift your hips up off the table. Good. Perfect. And then back down. Great. All right. All right, so as we're laying here, your left leg is longer than your right leg. Did you know that?
I did.
Okay. Anybody ever heard that? Yep. Okay. Is your left leg really longer than your right leg?
No.
No. Okay. Rare. Happens. Do you ever have fractures in your leg when you were a kid?
No.
Okay. Okay. Knee or hip replacement?
No.
Okay. All right. Unlikely that this is a true leg length discrepancy, meaning we take x-rays of both these legs and measure them, if there's going to be a difference. It's usually that if this leg is long, this ilium, okay, so your iliums are, if you put your hands on your hips, these big pelvic bones that are here, right? Huge pelvic bones. Either this ilium is rotated forward, which would make the left leg longer, or the left ilium is rotated back, which would make that leg shorter. Now, it's not like a 2-inch difference, right? So she's not walking around like, oh man, I'm like off. That's rare. It does happen occasionally, but usually it's just a little bit, right? So a lot of times side of symptoms, so she's saying pain in the right. So if I were to guess, because we've got to find out which one is rotated incorrectly, right? So it could be one or the other. And how we find that out is we find the one that's stuck, the one that doesn't move properly. Typically that's the one that's causing the problem. We mobilize that and that usually balances that out, okay? So how we find that out is we have to assess how the joint moves. So are you okay laying on your stomach?
Yeah.
Okay, so lay over on your stomach. All right, so just kind of flat down at the, yeah, perfect. Okay, so you have two iliums, and they come together, and they attach to your sacrum. You know what your sacrum is? Your tailbone, like this triangle-shaped bone that's wedged at the bottom of your spine. So you've got two SI joints, sacroiliac joints, okay? And usually one of them is stuck. That's the one that's causing the problem. So when I put pressure here, I have any pain when I do that? Okay. And then same thing here. Any pain when I do that? Yeah, so when these joints are rotated, typically the ligaments that attach them together, if there's stress on those, then that will cause some pain to palpation, so when we touch, right? So just kind of relax. You're going to feel me kind of pulling the front of your hip. So all I'm doing is I'm seeing how this joint is moving. Every joint has a certain amount of mobility. There's not a lot of motion in the SI joints. So like your elbow and your wrist moves a lot, right? So your SI joints, they kind of stick together, and then they have to have a certain amount of motion. Okay, too much motion is bad. Not enough motion is bad. You want to have it kind of equal in the middle, and you want it to be symmetrical side to side. So if one side is stuck and the other side is not, then that causes a problem. Okay? I feel like that, if I were to bet right now, I bet that's the side that's stuck, but we're going to check this side too. All right, so here, yeah, that moves fine. Okay. All right, so can you lay onto your left side? All right, so this is not rocket science. Physical therapy, a lot of it is if there's joints that are not moving enough, you've got to mobilize those. And if there's joints that are moving too much, you've got to stabilize those. Okay? So right now, this SI joint is not moving properly. So all I'm going to do is a mobilization to kind of get it moving. So just kind of relax here. You're going to feel pressure there, but I don't want to feel any pain. You doing okay there? Okay, good. All right. Doing okay there? Okay, so all I'm doing is I'm pushing the ilium forward on the sacrum, because this thing is stuck. There's lots of different ways that you can do this. You can do a manipulation, or what we call grade 5 mobilization, where you might feel like a pop or a crack. Has ever any gone to a practitioner to do that, right? Yeah, so I usually don't do that without a little bit more history workup. So I'm just gonna do a really simple mobilization like this and just see if we get anywhere. Hey, doing okay there? Yeah. How about that? All right, so lay back over onto your back. We're going to bend both your knees, and we're going to do that same thing. Push down with your feet, hips up off the table. Good. And then back down, and then relax. Okay, so I don't know if you guys believe me or not, but this is level. Did I just fix all our problems? Probably not, but let's go ahead and stand up. So this is also what physical therapy is. It's test, treatment, retest. We tested something, hey, we treated it, and now we're going to retest. So let's go back to our insulting movements here. So kind of the side there. So worse, better, same.
It's better, actually.
Okay, so significantly better?
Pretty much better.
Yeah, okay.
Yeah.
Like no pain?
No, I still have pain.
But not 100% better. Okay.
Right.
And does that make sense? If it wasn't 100%, if it was 100% better, then the first test we did where I had to kind of stabilize there, then that wouldn't make sense to me. That'd be kind of funny. It happens, but kind of rare. Let's go to the other side, and then what happens there?
I think that's less pain.
Okay. Yeah, motion's better too. So you guys probably can't pick up on that, right?
Yeah.
So so we found kind of two problems, but that's kind of what physical therapy is, right? So we've got to kind of find joints that aren't moving properly, mobilize them. The harder part is the stabilization. Like this takes 2 seconds. This is like the magic trick. The other stuff, like getting this figured out, where I went in and stabilized those joints, that's the harder stuff, like kind of turning on core musculature. So if I said to you guys, hey, you got to get your core stronger, what exercises do you think you should do? Sit-ups. What else? Planks. What else? What's that? Yeah, stomach muscles. Sit-ups, planks, leg lifts. Yeah, yoga and Pilates, that's better. Okay, so you can get stronger doing those things, but if you don't figure out the fundamentals of spinal position and where your spine should be, you're just putting strength on top of dysfunction. Okay? And that's why people fail physical therapy a lot, because they do basic core exercises, because they heard somewhere, like on WebMD or something, I got to do core exercises, and it just didn't get any better, because you're not doing the right stuff. The real muscles you need to turn on are your pelvic floor, okay, muscles that kind of hold your organs up. Transverse abdominis, muscle that wraps from your thoracolumbar fascia all the way around to the front, so it's kind of like the barrel to your core. Your diaphragm, so we do a lot of breathing exercises in physical therapy. And your multifidi muscles, which are muscles that attach from segment to segment in the spine, and they provide stability. Right? And the exercises we would do for that would be pretty goofy. Like if you came in and did physical therapy, you're like, I don't know about this stuff, but it's the fundamentals, right? So we wouldn't take a kid that has never played basketball before and throw him on the court at the NBA Finals, right? He's got to learn the fundamentals first, right? So that's what we teach in physical therapy. All right.
Yay.
All right, let's give you a hand. Thank you for coming up.
I'll see you again.
All right, so let's go through the rest of this here. So I have pain with. So please circle the things that you have pain with. So the most common things we see people with pain is standing and walking. Anybody have pain when they go to the grocery store? They can go a little while, they have to sit down, and then pain goes away, and they can get up again and then keep walking. Right? Pretty common, right? So if you're over the age of 65, 98% chance you have some spinal stenosis. Okay? So spinal stenosis isn't bad. The diagnosis of spinal stenosis isn't bad. I have spinal stenosis in my spine. I never have pain. Almost anybody that has some kind of disc injury is going to have findings of some kind of stenosis, right? It doesn't mean it's symptomatic. It doesn't mean that that's what's causing the problem. But most people that kind of present like that have some spinal stenosis. So sitting, lifting, like having to bend down and pick things up. So if this is bothering you, circle it. Changing positions, getting in and out of the car. Right? So those are typically my sacroiliac joint problems. So like people that have SI joint problems, like turning and rotating in bed, getting from a low chair to a high chair, if you're having those problems, usually that's a pretty straightforward SI problem that's easy to fix. Golf and tennis, so my rotational athletes, those are my SI athletes. Running, getting into a comfortable position at night to sleep, that's pretty common. First thing in the morning or end of the day. Anybody know why they have pain first thing in the morning or at the end of the day? Typically first thing in the morning, that's a pretty straightforward sign that there's some kind of inflammatory response going on. Can be like an arthritis, can be a disc bulge, some kind of inflammation that kind of builds up at night because the muscles aren't activating anymore. Okay? Anybody get frustrated because they can do a lot of activity and have no problems and then sit down and then they have pain? Yeah, why is that? Okay? It's because when you're moving and walking and the muscles are activating and contracting and relaxing, that's one of the main components of decreasing inflammation in an area, pulling inflammation out of that area. Okay? When you stop and the muscles don't turn on anymore and you typically get into poor spinal position, and then that causes more inflammation and causes the pain. Okay? End of the day, anybody have pain as the day goes on? That's usually a stabilization issue. Right? So I want you guys to think about the body and muscles as having a gas tank. So the muscles in your body, the muscles that stabilize what's going on here, have a gas tank full at the beginning of the day. And then as you do more stuff, you're using up that gas, and then the muscles can't stabilize the joints. You lose some of your joint positioning integrity, and then you get an inflammatory response at night. So that's why that happens. Okay. The number one single biggest mistake that sciatica and low back pain sufferers make is what? They ignore. You got it. Okay? They ignore it. They hope that it goes away. That's what everybody does, right? All right, so let's go through kind of the different kind of courses of care and kind of psychology behind back pain, because that's a really big deal. So what are your options if you have back pain? One is you ignore it. 15 minutes. Whew. All right, we got to go. You ignore it, right? You hope that it goes away. Hey, you guys want the fire alarm analogy or the leaky roof analogy? Quick. Leaky roof. Okay, I moved into my house like 10 years ago, and when it rained really hard in the ceiling tiles, like you would see some water build up, right? Okay, and then when it stopped raining, I didn't have a problem. And then it rained really hard again, and then the thing got bigger. I knew there was something wrong, but my house still worked, right? I turned the lights on, it worked. The refrigerator worked. So I was like, I'll just get around to fixing that eventually. Okay, so end of the story. Rains really hard. Water runs down the side of my house, goes into my kitchen, pulls up all the floorboards in my kitchen. Right, you know how expensive that is? Expensive, right? If I'd addressed the problem initially, and there was just some flashing that was not attached properly on the top of the roof, then I wouldn't have that huge problem at the end. That's what I want you guys to kind of conceptualize, right? So that's why we have these huge costs, because you don't address the problem initially. And then it doesn't get addressed properly when it's really just truly as simple as that, like mechanical stuff that goes on. So don't ignore it, right? So number 2 is we alter it. All right? Anybody ever use the back brace? You ever have it work? Usually pretty effective. Like if you have acute low back pain, like you throw out your back, you put a back brace on, that's going to do a pretty good job. Why is that? It's exactly what happened here, right? I'm your back brace. Oh, pretty good, right? But you're altering it, right? You're not changing it. You're kind of doing something that can help in the short term, which is not terrible as long as it's short term, as long as it's not a long-term strategy, but you haven't fixed the problem. You guys ever see the guys that walk around in like Home Depot and Lowe's that have the big back braces on? I never see a person that comes in and says, I was picking up the end of a couch at Home Depot and I hurt my back. You know when I see that person? It's when they take that back brace off and they go to untie their boots every single time, right? Because now you've worn a back brace and you've done the job for your body that it's supposed to do. So guess what? Your body is an efficiency machine. If you're going to do something for it, it's going to be great. I don't got to do that anymore. So you wear that thing, unless you're going to wear that thing 24 hours a day for the rest of your life, you cannot wear that for long periods of time because the muscles that stabilize your spine that we talked about, they're like, I don't have to do that anymore. Right? Okay, so you've altered it. You haven't changed it, you've altered it. Or pain medication. Everybody ever take pain medication for back pain? Anybody ever have it be effective? Okay, right? So, but what happens? You don't take the medication and then the pain comes back. Right? So you've only altered it. You haven't changed it. Yeah, and some people can't take medication, right? Exactly. Right. We want to try to get off medication as much as possible. You guys listen to Dr. Mead talk? Anybody hear him talk? Okay. So he talked about some natural anti-inflammatories. He also talked about the opioid problem in our country. Anybody know about that? Okay. You know what percentage of people that are heroin addicts started on opioids? 80%. 80% of heroin addicts in this country, the first thing they took was a pain medication. Okay, so we've got to try to avoid that for lots of different reasons. And it's not fixing the problem. Okay?
So what happens, you can't take the opiates, you don't want to.
You got to fix the problem. That's number 3. Wow, this is great. I should have paid her. Some anti-inflammatories can be effective, but it's not a long-term solution. You're not fixing the problem, right? So the other option is that you fix it, right? So you fix the problem that's going on, and you don't need all that other stuff. You don't need to alter it or ignore it. All right, so the 3 most common causes of low back pain and sciatica. Herniated what? Disc. Good. All right, and this is pain with what? Bending forward or bending backward? What do you think? I got a herniated disc? Bending forward. Right. Wow, you guys are really smart. Let's go through some mechanics of why that is. All right, so I'm not the best artist, but we're going to do Pictionary. You guys ever play Pictionary? Yeah. Anybody know what I'm drawing yet? Close. This is spine, right? These are spinal segments. Okay? There's 5 segments in the lumbar spine. We're going to put L4 and L5 here because 95% of problems occur at this level. Anybody know what's in between that? Disc. Anybody know what the disc does? Thank you. The disc does cushion. That's one of its jobs. Its most important job is that it's a ligament. Anybody know what a ligament does? This is like extra credit. It attaches bone to bone. Okay? So anybody ever sprain their ankle? Hey, or know someone sprains their ankle? What happens? They keep spraining it. Why? Oh yeah, overshot. Right? So you've stretched the ligaments. These are not muscles. Muscles contract and relax. Ligaments attach bone to bone. The biggest problem that you have with a disc problem, any kind of herniation, rupture, bulge, whatever you want to find in your MRI findings, is these 2 segments now move excessively. Okay? I bet if we took an MRI, there'd be some kind of disc finding in the lower part of your lumbar spine. Okay? Doesn't mean that that's like exactly what's causing the problem, or it doesn't mean, please, it does not mean that you're going to have this problem forever. I have 2 herniated discs in my lumbar spine. I almost never have back pain unless I do something really stupid. Okay? Doesn't mean you're going to have that forever. It just means you have to address it properly. All right, so what are the big problems when you have a disc problem? So in here, I don't love this analogy, but it's kind of like a jelly donut. So when I come forward, so this is me, this is my front, this is my back. When I bend forward incorrectly, I put pressure here, and what happens? Jelly goes that way, right? Right? Here's the problem with that. What's behind this? Yeah! Spinal cord. Guess what you don't want pressure on? Okay, off of your spinal cord come spinal nerve roots. So these nerve roots here, all the way up to L1, those come down and they make your sciatic nerve, right? So if you have any kind of pressure, I'm talking the lightest pressure possible on a nerve, it's going to let you know about it through numbness, tingling, burning, right? So if you're bending forward, that's going to make that pain worse. Or some people will say sitting too, because essentially people sit, what do? They go like this, right? So now what happens? I'm putting pressure on the front, goes out towards the back, right? So usually age what or younger? People with disc problems most commonly are age what or younger? 40, 50, right? Because what happens is as you get older is that you lose some of the water content in your disc and you get a little bit shorter. Anybody taller now than they were in their 20s? Yeah, it doesn't happen, right? That's part of it, right? So you lose some of your water content, so you're actually less likely to have a disc injury, which is good. So you can, as you look forward to getting older, you're not going to have as many disc injuries. Okay? All right, so stenosis, DDD, which is degenerative disc disease, or what? What's the most common term for this? Starts with an A. Yeah, arthritis. Okay, that's just the general term that comes out of diagnostic testing is arthritis. And it just means there's less space in between here and here. Okay? So this is usually pain with what or what? So think of our grocery store analogy. Okay? Pain is worse with standing or walking, right? Why? When I stand or walk, I'm coming into extension, right? So what happens is as these spaces get smaller, so there's this thing called your vertebral foramen, which is just the hole that's created when these 2 bones come together. As this gets smaller, the space gets smaller. So you have less room for error for this nerve root to come out. It means you get pressure on that. Okay? So as pressure comes on that, as you get into extension, does it make sense that as I bend backwards, this will get smaller? And then how do I relieve that? Bend forward, right? So this is the grocery store, right? So I feel great when I'm doing this, but when I have to stand up, I can't do it. Okay? So that's why that happens. So if you're having pain with that, then that's why that's happening. All right. SI joint problems. So we talked about that. We had some SI joint problems here that we fixed. And so SI is sacroiliac, if you want to write that down. Ages what to what? This is a trick question. 9 to 90. I've seen them as young as 9 in my clinic, and I've seen old as 90. Typically a younger person's problem. Every once in a while, I'll have someone that's over the age of 60 that will come in with a problem like that, and I get to say, wow, you have really young SI joints. Okay? All right, I'm going to take questions after because I only got 5 minutes left, and I got to spit all this stuff out. All right, so, and usually sitting, pain worse with sitting or change in position. So we talked about that a little bit before, too. All right, so we've talked about some forms of treatment. We've talked about, what kind of back pain that you have. So what does successful treatment look like, right? Like how do you get into this 90%? So it's manual physical therapy. So if you went to PT and no one laid a hand on you, you didn't go to PT. Okay? I can't control what happens in other places in the valley. I can only control the 14 therapists that I have. But I can promise you that if you went to treatment in my office and no one touched you, there'd be a pretty rough meeting at the end of the day. Okay, to mobilize the SI joint, so we kind of did some of that here, mobilizing the SI joint, and or lumbar spine. So balancing out those forces. So if these are moving excessively, what's usually happening is the joint above and below that is stiff. It's not moving enough. So all the forces are occurring here. So we've got to stabilize here for sure, but she had an SI problem that wasn't moving properly. So this is stuck, so now the joint above that has to move excessively. And guess what? The upper lumbar spine is not moving well enough too. Okay, so we've got to go up there and kind of we've got to mobilize that, the segments that are not moving properly. We've got to stabilize the segments that are moving excessively. Okay? And the last thing we have to learn is the 3 non-negotiables of spine health. Anybody remember those from the talk? Non-negotiables. Neutral spine, we got 1. hip mobility and nerve mobility. So hip mobility is hip motion. I would love to go into this more. If you guys want to talk to me later, we could talk about it. Nerve mobility. Let's talk about that quickly. So nerves you cannot stretch, or at least you don't want to. If you had tight hamstrings, I can give you soft tissue mobilizations, which will be on the courses that you guys sign up for. Soft tissue mobilizations and stretches that you can do at home. And that will change the length of that tissue. I can, to some extent, change the length of your muscle tissue. I cannot, or at least I hope I don't, change the length of your nerve tissue. If I stretch that out, I'm going to damage it, and you're going to be really mad at me. Okay? So, but it has to move properly from the place that it starts to the place that it ends. And it starts up here in your brain and your spinal cord. It goes all the way through your body. And if you're not having normal nerve mobility, if that nerve doesn't glide back and forth because you've had a long history of back pain or other injuries, there's an inflammatory response that kind of traps the nerve and doesn't allow it to move back and forth in the path that it travels, then that can cause pain, numbness, tingling, or burning. Almost all of my lumbar patients that I see, there's some kind of nerve mobility component to that we need to address. So if you've had physical therapy before and you don't know what nerve mobility is, or you haven't had that explained to you, then that's probably why you still have back pain. Okay? So you guys have some choices. I got like 30 seconds left. They're going to kick me out of here. So what can we do? We can continue to ignore it. Right? You can walk out of here, go away, keep your back pain. I hope you don't, because like we talked about, it's pretty simple to fix mechanically. Right? You can alter it. You keep altering it, taking your pain medications, doing back braces, doing other things to alter it, or you can address it or you can fix it. Okay? That's what we do. Right? We have a pretty high success rate. So in order to take the risk off of you guys, what we do for anybody that comes and does our talks is we offer a free screen. Yeah, free screeners in our office is a 30-minute appointment, one-on-one with a physical therapist. We don't take any money. We don't take your insurance information. It's basically a chance for you to interview us, because a lot of what we do is kind of talking people out of the fact that they've gone to physical therapy before and it didn't work. Right? So in order to kind of get over that, what we do is we offer this in any of our offices. We have 5 offices across the valley. If you are interested in coming in and having a free screen, 30-minute one-on-one appointment with a physical therapist, you're going to get a diagnosis, you're going to get a prognosis, so how long is it going to take? Diagnosis, what's actually causing your problem, okay? And a plan, what we would do in order to fix your problem. Okay? So if you guys are interested in that, then find us. We're wearing these goofy Hawaiian shirts in our booth. Tyler will be in back here. We can schedule your screens. This is our busy season. I probably only have a handful of appointments in the next couple weeks in each of our offices. If you guys are really interested in doing this, I would talk to Tyler as quick as you can. Okay? And we hope to see you at the booth. And if you guys have any questions about what I talked about, they're going to kick me out of here, then you can come to my booth and we'll try to talk to you. The best thing you can do is sign up for that free screen. You're getting all your questions answered. Sound good?